Hey beauties, and welcome back to Aesthetic Chat with Kiki. I am your host Kiana Campbell, and I thought it'd be fun to do a little bonus episode for season 5. Honestly, because now I am graduated from DNP school, and there are so many exciting things coming up in my world, and just so many different learning takeaways that I took away from just being in a full-time 3-year program. And I promised I would record this episode for you all once I was finished. So first, I am trying out this video recording, and we'll see if we start putting up videos of both myself and our guest speakers for season 6. So just trying that out right now, which is really exciting. But let's just jump right into program final thoughts. So, as everyone knows, I went through the University of Nevada, Reno. It was all online except for the 1 week required in person, which was a year before the end of the program, which was right before clinical started, and then the in-person clinicals. The positive side of if you're local to Reno, they are really good about actually setting up your clinicals for you. In my case, I did have to find all of my own clinical sites, and I will say probably the only feedback I do have for the program would be not necessarily finding sites, because I was actually able to find sites fairly quickly and or preceptors willing to precept me, but the, how do I say this, back-end logistics of trying to get me into those clinical sites ended up being far more complex with not as much follow-up. I understand that there are multiple students there trying to place and get those, agreements in place to where I can be a student there. But I would say that it required me to follow up multiple times. There are positives and negatives, but I was really encouraged to find clinical sites that were small local practices to avoid some of the headaches trying to do bigger rotations or practices that were affiliated with bigger companies. So, for example, the large hospital organization that is local to my area in Coeur d'Alene, Spokane, is Providence, and Providence is religiously affiliated. And based on the affiliation agreements that need to happen between both the school and your clinical site, I was told that the language that is in the affiliation agreements, they often get into a standstill with organizations that are religiously affiliated. So that would be my one point of issues, but I would say that was probably the more challenging part of finding my own clinicals. And then again, not just finding the clinicals, because the clinical part was fairly easy. I had a handful of people that were amazing and willing to precept me. It was just getting that behind the scenes paperwork filled out and completed to allow me to be at clinical. The other thing I will say is what I've heard from other students going through other programs. Sometimes the faculty are not as supportive of those that are in aesthetic medicine and are wanting to continue a career in that. But what I will say UNR was really great about, I was fortunate enough to do some shadowing with the assistant dean, and she was actually the interim dean for a while, as well as my program lead. They were both super curious about aesthetics. They asked a lot of questions. They came in with a lot of, again, curiosity that I wouldn't say is received universally or unanimously. I think a lot of the times we do experience as people in aesthetic medicine kind of that, or it's considered, like a soft nursing career or just not in that traditional path. But I will say that the faculty was really amazing. Again, I got to do my DNP project related to aesthetics, which again, we find that some other programs do not allow you to do projects that are, unrelated to the coursework. So I think that they did a great job there. What I will say though is, and this is no fault at all to you, I do feel like they really prepared us for the exam, and I really did feel like I learned a lot in their courses. The one thing being, compared to some of my other friends and colleagues that have gone through different programs, at one point I was taking 7 classes at a time. That's a lot of classes. A lot of other programs do not have you do that many classes within one semester. And so if you're someone that's looking for a program where I don't want to say you don't want to work hard, but you don't want to take 7 classes at a time, the program that I was in is maybe not for you. What I will say also, looking back, and hindsight's 2020, I probably would have just gotten my master's and not have gone all the way through with my doctorate. The doctorate, again, is great for people who want to go into academia. That's great if you want to go into research. And it's also great if you really want to go into leadership. If you want to go into leadership, you want to go into politics. If you want to be a leader of a large organization, or again, go and advocate for policy and legislative change, the DNP 100% helps you gain skills and knowledge to begin to then do that. However, if you are someone like myself who wants to become their own medical director for their own practice or wants to go into aesthetics, at this time, I don't know if I would personally recommend someone go and get their doctoral degree, just based on a time perspective, a cost perspective, and really a need at this time. Am I immensely grateful for the fact that I have it now, and it's a terminal degree, so I won't have to go back for that doctoral degree at some point? Yes. But in terms of, time spent in school, trying to further yourself in your aesthetics career, it's unlikely to do that for you. Again, what I also will say, being a full-time student, I unfortunately did not have a lot of time to dedicate to continuing my aesthetic education. Prior to getting back into school full-time, I did try to go to trainings at least quarterly. While I was in the program, I was still able to do some amazing trainings, but I was able to do maybe 1 or 2 a year versus doing like 4 or more a year. So that's something I'm really excited to get back into, is really focusing on building my practice as well as continuing to build on my aesthetic knowledge. There's so many things that are constantly changing within aesthetics, and that's the fun and cool thing about being in the field that we are, because you get to see innovation and implement faster than other areas of medicine. So those are kind of my final thoughts on my program, my experience with the University of Nevada, Reno. Again, highly recommend. The staff were amazing. Just when you're choosing a program, especially if you're in aesthetic medicine, those are things to think about. Oh, the last thing. I did do a primary adult gero program. I did not want to do the peds section. I know it's really hard to find clinicals for peds. And with what we do not treat under 18, or at least I don't treat people who are under 18 years of age. So that would be another positive thing, is that, UNR does have the adult gero primary program. And when I applied, over 3 years ago, there weren't very many of those. So that's something to also take into account. So a question that I got a lot actually was, I was able to test for my boards prior to graduating. And I had a lot of questions about, how are you able to do this? Am I able to do this? Like those types of things. So first I want to kind of break up the 2 board exams that you can take. So for nurse practitioners, you can take the AANP or you can take the ANCC. The 2 main differences. So ANCC, I believe, has more questions. It also has questions that are related more to, leadership style questions. The AANP exam, however, is, I believe, less questions. It was a total of 150 questions, and it's all clinically based. So you're getting lots of scenario questions, you're getting a lot of assessment questions, you're getting a lot of pharmacology questions. Very straightforward exam. I personally decided to take the AANP. However, I do know other students did choose to take A and CC. So those are kind of like the easy nitty-gritty breakdown of the 2 exams that you can take. How was I able to test early? So I actually tried to front load all of my clinical hours for all of my semesters because getting those done quicker, what I learned and through my mentorship was if you can front load them, then it gives you time on the back end in case that there are any sick days, missed days, depending on your preceptor and how transparent and open that relationship is. They may be taking vacation, they may be gone. Like, there are so many different things that are outside of your control that you really need to plan for. So I front loaded all my hours, I got them done, and I was done early April. There is a clause with AANP that if you're in a doctoral program, you've completed your coursework, you can reach out to the dean to get early authorization to test. So what did that mean? I just emailed my program track lead. I then emailed the associate dean. They both agreed that I had completed all of the hours and, I only had a couple assignments left to go. That being said, so they were able to send a letter to AANP proving, I've met all of the standards and I'm okay to test early. I was able to get a letter and then I was able to schedule my exam for, I believe I took it May 8th. Now I want to double check. Yes, I took it May 8th. So if you're in a DNP program, you finish all of your stuff up, you reach out to them and you take your exam early, do it. This may sound bad, but I decided to not study to my fullest, take the exam, and then if I did not pass, then I was going to know exactly what I needed to study and then take it again. Luckily, it worked out for me and I did pass on the first time, so I did not have to do that again. But I also will say I didn't tell anyone I was even taking it. I think I told my husband, my mom, my dad, and my sister. Because if I had failed, that would have been embarrassing. So, if you can test early, test early. Best study tools for studying for at least the AANP exam. So what was nice was the way that UNR has set up their final semester was I was only taking 2 classes, the clinical course and then one other course. The other course was actually that whole semester was guided towards us studying for the exam. So we started the semester out taking like a Barclay exam, which is like a readiness exam. You can kind of look at the different areas that you need to work on. You created a study plan, and then you did a lot of like guided studying. So at the end of the semester as well, then you retook a Barclay exam, and then it would tell you like your readiness score. What I also really loved was with your tuition, UNR includes a subscription to Blueprint Test Bank, or also known as like Sarah Michelle's Test Bank. And I found that really helpful as well. So in preparing to study for the exam, I spent probably a week of really hard studying. But again, we were kind of, touching on different points throughout the semester. So I did all the questions in the Sarah Michelle, which it was guided towards FNP, even though I was adult Gerald primary. They're very similar. There's only, some PEDS questions that obviously I don't take. So the Blueprint Text Bank, I highly recommend. I did all of those questions. Then I also paid for, it was called through UWorld. The people that, have already done their undergraduate would be familiar with UWorld. But I paid for the UWorld FNP test bank as well, and I just kept taking a bunch of different questions. With the UWorld test bank, I will say I personally like their explanations for why questions were right or wrong a little bit more than I like the Blueprint test bank. So, 2 really great test banks. I found that it was easier to take questions, figure out which categories I was missing, and then going and supplementing that reading where I needed to. Okay, let me look up the review book recommended to us. So UNR and my track leader recommended the AGNP Certification Intensive Review. The questions that I was like either like, I need some more information on that, or like that one seems to be a pattern where I keep missing. Then I would go back to the intensive review, kind of read that section, and then if I had further questions, I would use like YouTube or different resources I had, clinical practice guidelines to kind of supplement that information. So I thought that was really helpful. The last thing that I did through AANP's website directly, they have, I believe, 3 practice exams for FNPs, but 2 practice exams for primary Gero students, and they're $50 each. You can only take them once and review them once, but I would say like right before you're ready to take the exam, like a couple days prior, that was probably the most helpful thing that I did because it's through the exact same software that the actual exam is through, which I believe is like Prometric. And that was extremely helpful because it set it up just like the same testing environment. It looks exactly the same as the test. It has the same highlight, strike through features, like return back to question features. It just really set it up just like the exam. That, and if you look at how the exam is actually scored, it's not straightforward. When I was taking NCLEX, they tell you if you're scoring within this range, you should be fine. If you Google how the AANP exam is actually scored, the score ranges, and you don't actually know, obviously, which questions are going to be weighted more, as well as there's 15 questions in there that are like the beta questions for future exams. So 15 questions already that are sprinkled in, you don't know if they're going to count towards your score or not count towards your score. So I would say that I felt most confident after taking those 2 practice exams that are through the AANP website. They were also not super expensive. They were $50 per exam. So do all the studying and feel as confident as you can, then take those, and that would be, I think, the biggest indicator if you're ready for the exam or if you're not. But I went into the exam and I felt fairly confident. I didn't feel like there were any questions that I was like, "Oh no, I don't have any idea." There wasn't any question that I didn't feel like I could make a confident guess if there was like slight hesitation, but I had plenty of time. They give you 3 hours total for the 150 questions, and then immediately after you are done and hit submit, it will tell you like your preliminary result, which is like pass or fail. It doesn't tell you your score or how many you got right or how many you got wrong, but comforting that unlike the NCLEX, you get your result right away. So those are like my best study tools for boards. Then, I wanted to touch on this actually because I don't think I've actually touched on it on any of my other podcast episodes. But my DNP project that I defended was implementing a screening tool for body dysmorphic disorder in a cosmetic setting. I used a validated screening tool. It was the COP screening tool. Honestly, I thought it was amazing. Again, I only implemented it in one small practice, which was obviously not my own because there's a conflict of interest there. But since implementing it in colleagues' practice, I have now implemented it into my practice regularly with intake forms, and I do have patients fill this out every year. Within my research, majority of people have decided not to use any of these screening tools because they cite that it takes too much time. But this questionnaire is 10 questions. You tally up each question minus question 1, which I'll run you through like the questionnaire itself. It's 10 questions minus the first question. You tally up the total, and if it's over 40, which is nice because it gives you a definitive like concerning or not concerning, over 40 warrants further conversation as they're showing high likelihood signs of body dysmorphic disorder behavior. If it's below 40, then based on the screening tool, there is no concern you can likely proceed with treatment. I personally like using this because I think as an aesthetic provider, we do talk about, having those gut feelings and obviously not treating if they're, again, not a candidate, not appropriate. They're showing different red flag signs. But I have found that having a clinical tool like this with data, so like a score above 40, that helps support that gut feeling as well. And so you can come to the patient with signs of concern, ask more questions, as well as I did develop a protocol through my project of what happens when someone tests positive. And with myself, I have decided that if they do test positive, I want them to go and see a mental health professional, whether locally, virtually, because again, I can't necessarily diagnose them with BDD, but I want to make sure that, we're on the same page. Studies are kind of mixed, I would say. So there are studies that show that treating patients with BDD, it can cause more harm than good, but they're also showing that possibly with minor cosmetic procedures, the ones that we are performing, can show some benefit to some extent. Majority of the literature out there currently is, again, BDD is focused on surgical intervention, not minor cosmetic procedures. So to err on the side of caution, if you're going to screen positive for me, it warrants a further conversation and it says, I'm not saying that you aren't a candidate in the future, but right now I don't feel comfortable treating, and I've only had that conversation a handful of times, but I do feel like this tool is helpful and supportive, and patients are really understanding when there's, clinical evidence versus just that gut feeling. Again, we also have those gut feelings, and when you have them, follow them, don't treat. Even if they aren't showing clinical signs of BDD, it's okay to say no. And honestly, you save yourself way more headaches if you just don't treat the patient. But what I will say is having a screening tool like the COP screening tool helps further support. And also, I do feel like it helps legitimize what we do a little bit more. And it brings us back to the fact that what we do is medicine. And, it's not just fluffy, feel great. There is a lot of science that's behind it. And again, this is a medical specialty. It's not just fun. Yeah. So let me run you through like the questions and how it kind of works. So question 1 asks features causing concern. Please describe the features of your body which you dislike or would like to improve. Gives you the option to list features 1 through 5. Then it asks you to draw a pie chart and estimate the percentage of concern allocated to each feature. Asks you to ensure that your percentages add up to 100%. So question 1 does not get included in the score, but then questions 2 through 10 do. Question 2 is how often do you deliberately check your features, not accidentally catch sight of? Please include looking at your feature in a mirror or other reflective surfaces like a shop window, or looking at it directly or feeling it with your fingers. So the patient can circle. So there's 0 to 8, 0 being about 40 times or more a day, all the way to 6 is about 5 times a day, and then 8 is never checking. Question 3 is how much do you feel your feature is currently ugly, unattractive, or not right? So 0 is very ugly or not right. 2 is markedly unattractive. 4 is moderately unattractive. 6 is slightly unattractive, and 8 is not at all unattractive. Question 4 is how much does your features currently cause you a lot of distress? So 0 is not at all distressing, all the way up to 8, which is extremely distressing. 5 is how often does your features currently lead you to avoid situations or activities? So 0 being always avoid, 4 is about half the time. 8 is never. 6, how much does your features currently preoccupy you? That is, you think about it a lot and it is hard to stop thinking about it. 0 is not at all preoccupied. 4 obviously is moderately. 6, very, and 8 is extremely preoccupied. 7, if you have a partner, how much does your features currently have an effect on your relationship with an existing partner? If you do not have a partner, how much does it have an effect on dating or developing a relationship? 0, not at all, to 8, which is extremely. 8, how much does your features currently interfere with your inability to work or study or your role as a homemaker? Please rate this even if you are not working or studying. We are interested in your ability to work or study. 0 being not at all. 4, moderate. 6, markedly. 8, very severely, I can't work. 9 is how much does your features currently interfere with your social life? 0 is not at all. 8 is very severely. And 10, how much do you feel your appearance is the most important aspect of who you are? 0 is not at all, to 8, which is totally. So as a provider, you just tally that score up and I place it in my note. So this screening tool does not take any time at all. I include it within some of the pre-paperwork, so the intake form that they do as a new patient. And then when they update their medical history that following year, they will also complete this intake form that has the screening tool in it. Again, BDD is a spectrum, and I think it's something important to continually screen my patients. Do I think it's necessary to screen them every time before every treatment? No. There's more research that needs to be done on it, but it did show that, possibly some treatments, not all treatments, need to be screened for prior to doing them. So for example, doing wrinkle relax or something that's not permanent or not severely altering. Is it completely necessary to do the BDD screening tool for that patient? More research needs to be done. But for doing things like threads and dermal filler and doing things that you're going to be altering or augmenting areas, 100% I think that requires further screening. To simplify things, I just have all my patients do them just so we're not, trying to figure out, did this patient get screened? Did this patient not get screened? But if you're interested in more of the project that I did, the screening tool, I'm happy to share more information on that. I'm also happy to do more of an in-depth episode, but super exciting. And also it's super awesome that UNR was able to allow me to do a project related to my field. And yeah, I had a lot of fun, and there's still so much more research that needs to be done, which is really cool. I think those were all of my final thoughts when it comes to school. Wow. If there are any questions that you guys have about school or my program or really anything related to this episode, don't hesitate to reach out. I am very excited to bring you more Aesthetic Chat with Kiki content at a more regular interval. I'm hoping to do another season here again before the end of the year. So I am currently reaching out to speakers and getting everything lined up for season 6, which is really, really exciting. So many things have happened in the last month, all super exciting. And I can't wait to share more about what those are and the future of both the podcast and my injecting career and natural aesthetic and wellness. So all super exciting things. And I just realized, can't even see my cute shirt. But besides the point, reach out if you have any questions. Again, you know where to find us. On Instagram, we are aesthetic.chat with Kiki. I'm your host, Kiana Gamble, which my Instagram is at aestheticnurse.kiki. The website is aestheticnursekiki.com. And if you are interested in getting injected by me, my practice is natural aesthetic and wellness. We are currently located in Coeur d'Alene, Idaho, and you can find more information about booking appointments with me on the website. Also, more exciting things to come, like mentorship opportunities and collaboration opportunities. So, Until next time, beauties. Bye.